Today, I'm very pleased to announce that we have partnered with the IU Richard M. Fairbanks School of Public Health on a scientifically designed study that will examine the prevalence of COVID-19 among Hoosiers. This study will also give us better understanding of the extent to which individuals are showing antibodies that indicate signs of past infection. We believe this data will better inform our plans to safely reopen our state and to determine what new normal mode of operation really looks like. Starting Saturday and running through next Wednesday, we'll begin testing selected Hoosiers who were chosen through this scientifically designed study to ensure that they accurately reflect racial, ethnic, and geographic demographics of our state. We've started reaching out to people today, and I hope that if you are contacted, you will agree to participate. We need your help to make sure that the data that we receive accurately reflects Indiana's population as we use it in decision-making for our state. I want to thank you ahead of time for your participation if you are chosen. I also want to thank IU Fairbanks, Indiana National Guard, EMS partners, Indiana State Department of Transportation, Eli Lilly, IU Health, Ivy Tech, Walmart, Zotec, and Maximus for their assistance and leadership on this project. It is now my distinct pleasure to introduce Paul Halverson, the founding dean of the Richard M. Fairbanks School of Public Health. Dr. Halverson is a past state health officer in the state of Arkansas, and he has been a consultant, a mentor, and most importantly, a friend to me since the first week that I started this job 2 years ago.
Thank you, Dr. Box. It's great to be here. I want to express our gratitude to both you and Governor Holcomb for leading Indiana's response to the COVID-19 pandemic. I just also want to say how appreciative we are to both of you for your evidence-based approach to the state's response to this pandemic. As Dr. Box mentioned, I'm Dr. Paul Halverson. I'm the founding dean of the Indiana University Richard M. Fairbanks School of Public Health at IUPUI. I'm especially appreciative of being able to describe to you the work that we've been doing. We were founded in 2012, and the Fairbanks School is committed to protecting and advancing the health of Hoosiers in Indiana and beyond. In the last 8 years, our faculty and staff have responded to public health and health administration issues with evidence-based research and practice, from the opioid and tobacco crises to rising healthcare costs, from developing maternal and child health interventions to leading a large-scale response to chronic diseases like diabetes. We've been on the front lines of public health and health administration, and we appreciate the opportunity to bring both research and practice to Indiana to support our partners in public health. We're also pleased to support Indiana's local public health departments through hosting the Local Health Officers Association in Seicho, as well as in training individuals who will be our public health leaders of tomorrow. In addition, we're proud to work closely with both Dr. Box and her leadership team here at ISDH, as well as Dr. Kane, our local Marion County Health Officer, all of whom, by the way, I think are doing an incredible job supporting our state through these very challenging times. We believe this close partnership between the school and our public health agencies is incredibly important. It brings important value to public health effort in Indiana. Since the emergence of this virus, our school has been supporting the state's response to COVID-19, working with public health officials and hospital leaders, including the Indiana Hospital Association. We created forecasting models to predict the spread of COVID-19 and to understand the needed hospital surge capacity for the state. With this knowledge, we developed capacity planning models for hospitals and health systems. Now our school is helping to lead an initiative that you'll hear more about regarding random sample testing across Indiana for the virus that causes COVID-19 and its antibodies. I'm pleased now to introduce my colleague, Dr. Nir Menachemi, who will be leading this population health scientific testing effort. Dr. Menachemi is the Fairbanks Chair of Public Health and leads our Department of Health Policy and Management. He's also a scientist at the Regenstrief Institute and is one of the most widely respected health services researchers in our country. His research has led to numerous organizational and societal decisions that have made enduring contributions to improving people's health in Indiana and beyond. Nir?
Thank you, Dr. Halverson. I am pleased to lead the scientific team in our partnership with the state, which includes multiple agencies and private organizations that Dr. Box mentioned. The team from the Fairbanks School includes leading biostatisticians, epidemiologists, informatics, and clinical infectious disease experts. Together with the state, we are taking a critical step towards understanding how COVID-19 has affected the population of Indiana. I want to highlight an important distinction in how this testing initiative differs from existing testing endeavors. To date, almost all of the testing that has occurred has come from patients with serious symptoms or other high-risk individuals, including our frontline healthcare workers and essential employees. Existing tests were purposefully focused on clinical or congregate settings to support clinical decision affecting individual patients. Because these tests focused on sick and high-risk individuals, we lack an understanding of how many people in our state have been infected, especially if they were not formally tested or had no symptoms. This is where our work comes in. We will obtain scientifically valid results of the proportion of state residents that are currently infected, regardless of symptoms, and those that may have already been infected with the virus based on antibodies. We will finally obtain an understanding of the true prevalence of COVID-19. The individuals we will test have been selected randomly to represent everyone in the state above the age of 12. Each selected individual will be asked to volunteer their participation with parental approval as necessary. Those agreeing will provide both a nasal swab to test for active viral infection and a blood draw to allow for antibody testing. Whereas existing tests have supported clinical decisions of individual patients, our approach will allow for a community-level understanding of the virus's impact. This will enable better evidence-based policies, including the complex decisions surrounding social distancing orders. As mentioned, we have identified a representative sample of Indiana residents by randomly selecting people in each district of the state from a list of all residents. Our randomization protocol was carefully calibrated to ensure the ability to draw conclusions about the impact of COVID-19 by each of the state's districts and by sex, race, and ethnicity, as well as the overall rate for the state. For this reason, if you are selected, please consider participating so that your community, however you define it, can be represented in our data. Our overall plan is to conduct multiple waves of data collection that will occur months apart. Wave 1 will start immediately and provide critical information, including establishing a baseline. Each additional wave of testing will allow us to examine how changes in the prevalence of the disease is progressing in Indiana and how it's affecting the groups I just mentioned. For each wave, we will enroll between 5,000 and 7,000 individuals statewide. In order to adhere to the scientific protocol, only those contacted by ISDH will be able to participate. Unfortunately, we will not be able to test others at these drive-through testing locations. Before I turn it over back to Dr. Box, who will describe the logistical and operational plan, I want to reiterate the importance of our study in determining the true count of infections, including mild cases, which represents important information not currently widely available in any state. By being one of the first states, we will get a head start in understanding the epidemic's true trajectory, identify and address disparities, and be able to make wiser decisions on how to deploy our limited resources. Thank you, Governor Holcomb and Dr. Box, for your leadership during these challenging times. We look forward to playing a part in advancing Indiana towards a sense of normalcy. Dr. Box, back to you.
Thanks, Dr. Menachemi. So we will be doing sampling at 8 fixed drive-through sites across the state, which you can see here in red. And there will be 10 mobile RV sites that will go to all of the areas in blue, hopefully bringing us close to everyone that is selected for this particular study. We're very grateful to our community partners who will be providing sites such as Ivy Tech, Walmart, the Teachers Treasury here in Indy, the Healthy Beginnings in Elkhart, Ascension at St. Vincent, and Parkview Health. We also are very grateful to our workforce medical workers who will be the phlebotomists and our paramedics from the National Guard to take the blood samples, and EMS providers who will work to collect specimens. I really wanted you to see this slide because it really truly does take a village to pull off something like this, and we are grateful to everyone who is contributing to their part for this study. Every participant who has been chosen will receive a postcard and a phone call. They may potentially, if we have an email up to date, or they may receive an email or even a text message. You will be asked on the phone call demographic and medical information, and I promise you that you will receive complete privacy and that we will protect that privacy. You will also be able to go to a website to register, and you can choose on the website the time most convenient for yourself and the location closest to you. When you arrive at the test site, if for some reason you have not been able to register online, you can actually register at that time. And we will be obtaining a swab of your nasopharyngeal area, and also we will be doing a blood draw at that time. Unfortunately, if you had not been chosen to be a part of this study, we will not be able to test you at that time. Lastly, I just want to say, please help us with this study. If you're chosen to participate, please do so. The validity of this study really depends on us having an accurate representation of all Hoosiers all across our state. Thank you.